Welcome back to Midday. We have Dr. Desai on the show, a laser implant periodontal specialist. Thanks for joining us, Preeti.
Thank you, Tanya.
So we're talking about osteoporosis. Now, October 20th is Osteoporosis Awareness
International Day.
International Day.
Yeah.
How does this really relate to your health in your mouth? Because when you think osteoporosis, at least for me, I don't automatically think mouth.
That's right.
So how does that relate?
And you're not alone in that opinion, and that's part of the reason of trying to share our knowledge in dentistry. If a person, often women after menopause, are at risk for osteoporosis, if they have gum disease, they can actually have more bone loss in the mouth, affecting their dental health, if they didn't have osteoporosis. So it's really interconnected.
Okay. Now, we were talking a little bit right before the segment about medications, and lots of people, when you are on these kinds of medications for osteoporosis, that can be really harmful.
It's something to be aware of, definitely. Drugs such as bisphosphonates, which are like Fosamax and Actonel, Benevia, a lot of women and men are on it to protect against, hip fractures and broken bones, because their bones tend to be more porous with osteoporosis. And so part of the way the drug works is to decrease the amount of wound healing, the health, the turnover of the new bone. When a dental procedure is done, that is a risk factor. So often a consultation with that patient's medical doctor to say, is it important to be on the drug the whole time? Or can I take a little drug holiday? Not a party, but a break from the drug, and have the dental procedure done and then go back on the drug after that.
We have 4 pictures, I think, here, and maybe you can explain what we'll be looking at here. Well, this is osteoporosis, all related to osteoporosis, but what are we looking at here?
The top left picture is a part of an x-ray, and you can see the black hole in the middle, and that is that's called osteoradionecrosis of the jaw. So that's how the bone has healed poorly after an extraction. So it's more porous to begin with, and then we don't heal properly afterwards, so it doesn't become...
Which is what you were just talking about.
Exactly. And the lower left is that clinical appearance of the same jaw, that this is how the gum doesn't heal completely after an extraction and heals very slowly.
How dangerous can that be if you're, if your gum is healing slowly or not at all?
It is a risk factor for further bone loss, and if there's no blood healing, like a cut on your skin, if it doesn't heal properly, it's a problem of infection, basically.
Is there a way to avoid this altogether? I mean, you mentioned taking that break from the medication might help.
Yes.
But how do you avoid this altogether?
Actually, in science, we don't know yet how to absolutely prevent the problem. We just know the risk factors leading to it, so we can control those risk factors. But the human body is individual, right? You could be at the far end or the beginning end of a spectrum of healing. So, just awareness is the most important thing, asking the right questions.
Do you see a lot of patients with osteoporosis and have to do procedures on them?
Yes, and that's where all the consultation with the patient's physician is vital, to say, how are we going to treat this patient so that they don't have any risk of necrosis?
Okay, so good to know. Really good advice, because again, like I said, at least for myself, I would never have... I mean, you do put 2 and 2 together once you start to think about it, but osteoporosis, you don't usually think mouth health right away.
And it's so important to, even if you're not taking, any medication, but your family members, your cousins, your mother, just to discuss it over the dinner table. It's not the hot topic, obviously, but, just, oh, by the way, just ask your dentist the right question if you're having something done,
Spread
like
that
an
awareness.
implant.
Good to know. Thank you so much, Dr. Desai. That was
Tanya.
wonderful, very informational. Information's on the bottom of the screen there if you want to learn any more about osteoporosis. You have any comments or questions for Dr. Desai, kamloopsperiodontists.com is where to go, and there's the number right there to give her a call. Thanks so much for joining us. We'll be right back after a break with Rick Turner. Stay with us.